بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. رمضان كريم علينا وعليكم، وإن شاء الله ما ينتهي هالشهر الكريم إلا وانتهت معه أزمة كورونا. والله يشافي الجميع ويبعدنا عن هذا المرض، وإن شاء الله ترجع الحياة الطبيعية قبل نهاية هذا الشهر الكريم إن شاء الله. اليوم سيمينار مالتنا هو عن موضوع Systemic Lupus Erythematosus. قبل ما أبدي أحب أشكر الدكتور خالد وسام عبدالفتاح المشرف على هذا السيمينار، وأحب أشكر السادة أعضاء لجنة السيمينارات في فرع الأمراض، والدكتورة زهراء رئيسة لجنة السيمينارات في كلية طب الموصل. Systemic lupus erythematosus or SLE is an autoimmune disease in which the immune system attacks its own tissue, causing widespread inflammation and tissue damage in affected organ. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels. It's characterized by antibodies to nuclear and cytoplasmic antigen, multisystem inflammation, protein clinical manifestation, and a relapsing and remitting course. Main organs affected in SLE are: first, inflammation of kidneys, called lupus nephritis, can affect the body's ability to filter waste from the blood. It can be so damaging that dialysis or kidney transplant may be needed. Second, inflammation of the nervous system and brain can cause memory problems, confusion, headaches, and strokes in very severe conditions. Third, inflammation in the brain's blood vessels can cause high fevers, seizures, and behavioral changes. Fourth, hardening of the arteries or coronary artery disease. This can lead to a heart attack in very severe conditions. So, this picture is lupus nephritis. Here are some glomeruli filled with inflammatory cells and debris. This is a sign of lupus nephritis and inflammation of the lupus nephritis. Inflammation of the nervous system and brain. In this picture, a neural tissue appear surrounded by inflammatory cells and debris. This is a sign of inflammation caused by lupus. In this radiography, we can see a swelling of a vessel or some vessels in certain area of the brain, as in here and here. This caused by lupus, so it can lead to seizures and many severe conditions. Lupus on coronary arteries, as we saw in the inflammation of the brain's vessels. Here are some swellings in the coronary artery of the heart, which make evidence that there is an inflammation caused by lupus on the coronary artery that can lead to heart attack. Causes of SLE. The immune system normally fights off dangerous infections and bacteria to keep our body healthy. An autoimmune disease occurs when the immune system attacks the body because it confuses it from something foreign. There are many autoimmune diseases, including systemic lupus erythematosus (SLE). The exact cause of SLE isn't known yet, but several factors have been associated with the disease. First, genetic. The disease is not linked to any certain gene, but people with lupus often have family members with other autoimmune conditions. Environment is the second cause of SLE. Environmental triggers can include ultraviolet rays, certain medications, viruses, physical or emotional stress, and trauma. Pathogenesis of the SLE. Systemic lupus erythematosus, or SLE, or as generally called lupus because it is the most common type of lupus, is characterized by global loss of self-tolerance. So, what is the self-tolerance? Self-tolerance is the ability of your antibodies not to attack your antigen or your self-antigens. When there is a global loss of self-tolerance, your self-antigens, your self-antibodies will attack the or your self-antigens. In the global loss of self-tolerance, your antibody will attack your antigens. With activation of autoreactive T and B cells, leading to production of pathogenic autoantibodies and tissue injury. SLE is characterized by production of pathogenic autoantibodies directed against nucleic acids and their binding proteins, reflecting a global loss of self-tolerance. So, the cause of global loss of self-tolerance is because the autoantibodies are attacking against nucleic acids and their binding proteins. Global loss meaning that the loss of the self-tolerance not in a certain area or certain tissue, but may be affected all or maybe affect all the body. This is the global loss of the self-tolerance. Mechanism of tissue injury. Most of the lesions of the SLE are caused by immunocomplex. Type 3 hypersensitivity, for example, DNA anti-DNA complexes can be detected in the glomeruli and small blood vessels. In addition, autoantibodies against red cells, white cells, and platelets causing effects by type 2 hypersensitivity reaction. Autoantibodies opsonize these cells and promote their phagocytosis, resulting in cytopenia. So we have two types here. Type 3 hypersensitivity reaction, DNA anti-DNA complexes detected in glomeruli and small blood vessels, and type 2 hypersensitivity reaction in blood vessels, and this resulting in cytopenia. Cytopenia is the lowering number of the blood cells. Symptoms of SLE are varies from person to person, patient to patient, and not all the symptoms are included in one patient. So hair loss, one of them, normally happened or usually happened in the front of the head. Headache usually occur because of lupus blockage of the oxygen in the brain. Sjogren's means that the patient feels his eyes and mouth are dry, mouth sores, the same because of Sjogren's, difficulty swallowing. Difficulty swallowing happens because of Sjogren's syndromes. Gland swelling, swelling of glands, especially sweating glands and lymph nodes. This is a sign of infection or lymphoma. Enlarged liver. Liver problems are caused by reduced by lupus, reduced blood supply by lupus. This leads to enlargement of the liver. Chest pain because of heart attack. Trouble breathing or difficulty breathing or even shortness of breath happen because of the fluid built up by the lungs, and pneumonia and maybe scarring with the lung. Pancreatitis happened by lupus or medication taken to manage the lupus. Heart disease, inflammation of blood vessels may lead to blockage of the coronary artery and heart attack. Kidney problems, this lead to renal failure and swelling of the whole body. Anemia happened because immune attack to red blood cells, or there is a bleeding because of inflammation of the wall of blood vessels. Pregnancy complications, digestion issues and intestinal ulcers happens because of medication as contraindication. Joint pain because of lupus arthritis, and tiredness, fatigue, often severe, and skin sensitivity. These are the last two are very common in SLE patients. So skin sensitivity is butterfly shaped rash, and skin sensitivity can be triggered by sun exposure or ultraviolet light. So skin sensitivity and tiredness are the most common signs and symptoms of SLE. I have to mention that lupus symptoms is also of many other disease symptoms, which can make diagnosis depends on symptoms is very tricky. Criteria of diagnosis is divided into two types: clinical criteria and immunologic criteria. Clinical criteria include acute cutaneous lupus, malar rash, and photosensitivity. Chronic cutaneous lupus, this called rash, erythematosus, raised patches, and adherent. Non-scarring alopecia, diffuse thinning or hair fragility in the absence of other causes. Oral or nasal ulcer, and maybe nasopharyngeal ulcer with no pain or painless. Joint disease, non-erosive synovitis involving two or more peripheral joints characterized by tenderness, swellings, and effusions. Renal disorders, persistence of proteinuria more than 0.5 gram per day. Neurologic disorders, seizures, psychosis, myelitis, neuropathy in the absence of offending drugs or other non-causes. Hemolytic anemia, leukopenia and lymphopenia. Leukopenia is less than 4/10^5 cells per liters. Lymphopenia less than 1.5 by 10 over 5 cells per liter. Thrombocytopenia is less than 100 by 10 over 9 cells per liter. Immunologic criteria: anti-nuclear antibody, abnormal alter of anti-nuclear antibody by immunofluorescence, anti-double-stranded DNA antibody, anti-Smith antibody, presence of antibody to Smith nuclear antigen, anti-phospholipids antibody, positive findings of anti-phospholipids antibody based on abnormal serum level of IgG, IgM, anti-cardiolipin antibodies, a positive test for lupus anticoagulant using a standard test, false positive serologic test for syphilis, low complement, low C3, C4, and CH50, direct Coombs test, SA4 anti-red cells antibodies in the absence of clinical evident hemolytic anemia. Treatment for lupus depends on signs and symptoms, determining whether signs and symptoms should be treated and what the medication to use requires a careful discussion of benefits and risk with a doctor. First, non-steroidal anti-inflammatory drugs, NSAIDs, anti-malarial drugs, corticosteroids, immunosuppressants, and biologics. Biologics are different types of medication. Simple example, belimumab administered intravenously also reduce lupus symptoms in some people. Rituximab can be beneficial in cases of resistant lupus. So what is the medical advices to SLE patients? First, you have to take steps. You have to take steps to care for your body if you have lupus. Simple measures can help you prevent lupus flares, and should they occur, better cope with signs and symptoms you experience. Be smart with sun. Because ultraviolet light can trigger flare, wear protective clothing such as hat, long-sleeved shirt, and long pants. Use sunscreen with a sun protection filter. Get regular exercise. Exercise can help keep your bones strong, reduce your risk of heart attack, and promote general well-being. Eat a healthy diet. A healthy diet emphasizes fruits, vegetables, and whole grains. Sometimes you may have dietary restriction, especially if you have a high blood pressure, kidney damage, or gastrointestinal problems. So you have to be aware. Take vitamin D and calcium supplement if you need. There is some evidence to suggest that people with lupus may benefit from supplement vitamin D. A 1200 to 1500 milligram calcium supplement taken daily may help keep your bones healthy. Thanks for watching and thanks for recognizing. Have a nice day and goodbye.